In this video we will show you how to treat a stye in your eye. Apply a warm compress for 10 to 15 minutes, 2 to 3 times a day. Don't squeeze the stye or wear eye makeup or contacts. Always wash your hands before and after touching your eye. Take over-the-counter medication for pain relief, and see a doctor if the stye does not improve within 2 days. Method 1. Identifying styes. 1. Look for a tender red lump on your eyelid. Styes are similar to pimples that form on the eyelid. Styes occur when bacteria, usually staphylococcus or staph bacteria, that live on the skin's surface cause infections in or near the eye. You can usually identify a stye from its appearance, a tender red lump on the eyelid which may develop a small pus-filled center. The stye develops inside the lid and protrudes either outward or inward. External styes involve Zeis or Moll glands and protrude out. Internal styes involve the meibomian gland and tend to protrude inward. An internal stye is just an infected chalazion. 2. Learn to recognize styes. Styes can be confused with chalazions, which also appear as a bump near the eye. The treatment of a stye and a chalazion is the same, so it's not a problem if you can't tell them apart. 3. Look for swelling. Your eyelid will usually swell up as the stye develops. In some cases, the swelling may cause your eyelid to close completely. The swelling will usually last for about 3 days, after which it will sometimes burst and drain on its own. Occasionally, the inflammation will spread to areas of the face surrounding the eye, in which case you should see a doctor. 4. Be aware of other symptoms. The swollen eyelid can irritate the eye, causing pain and watering. Your eyes may also be more sensitive to light. The swelling may cause discomfort when you blink. Method 2. Treating styes at home. 1. Apply a warm compress. The recommended home treatment for a stye is to apply a warm compress to the eye for 10 to 15 minutes, 2 to 3 times a day. This will increase circulation to the area and speed up the rupture and drainage of the stye. It is important to start warm compress treatment as soon as you identify the stye. Untreated, styes can last for several weeks, but treatment can cut this to just a few days. 2. Use an over-the-counter treatment. There are many creams, ointments and even medicated pads available over the counter that will help to clear up the eye infection causing the stye. Look for treatments that contain the ingredient polymyxin bisulfate, which is an effective antibiotic in treating eye infections. Make sure it says that it's safe for use in the eye. Ophthalmologists do not like OTC antibiotics because they are not safe if they get in the eye, which these ointments always do. Be wary of any product that claims to remove styes immediately or overnight. They are usually expensive and are unlikely to work as quickly as they claim. Stye treatment usually takes between 2 to 4 days. 3. Avoid squeezing the stye. Although it may be tempting to squeeze the stye or pop it with a needle in an attempt to drain it, never do so. Rupturing the stye can make the infection worse by introducing bacteria from your skin into the stye. Apply a regular hot compress and wait for the stye to rupture and drain on its own. Attempting to pop or rupture the stye can actually spread the infection from the stye to other parts of your eye. 4. Stop wearing eye makeup. While you are suffering from a stye, it is best to steer clear of eye makeup such as mascara, eyeliner, and eyeshadow. This will help to avoid irritating your eye and decrease your chances of reinfection. Since the infection is often present before you are aware of the symptoms, it is best to throw away any eye makeup applicators that you were using when the stye developed. This will help keep you from reinfecting your eye. 5. Avoid wearing contact lenses. It is a good idea to hold off on wearing contacts while you're suffering from a stye. This is because contacts could irritate your eye further, causing unnecessary pain. Switch to wearing normal glasses until the stye has cleared. Wearing contacts that you wore during the period of infection can reinfect your eye. Once your stye has cleared up, wear a new pair of contacts to keep your eyes healthy. 6. Keep your hands clean. Wash your hands with antibacterial soap and hot water before and after touching your eyes. If you touch your eyes with unwashed hands, you risk transferring bacteria to the unaffected eye. You might even worsen the initial infection. 7. Take over-the-counter medication for pain relief. Over-the-counter non-steroidal pain medication, such as NSAIDs like ibuprofen or naproxen, can help to ease inflammation and pain caused by the STYE. Always follow package instructions. If you are sensitive or allergic to ibuprofen or naproxen, acetaminophen can help relieve pain caused by the STYE. It is not as effective at fighting inflammation as NSAIDs. 8. Give your eyes a break. It is important that your eyes get adequate rest while you are treating a STYE. As you sleep, your immune system releases proteins called cytokines, which help fight infection and inflammation. Get plenty of sleep at night and avoid doing too much reading or other visually detailed work. Thanks for watching. Subscribe our YouTube channel for more videos.